The Centers for Disease Control and Prevention considers prescription drug abuse to be the fastest growing drug problem in the nation and a major contributor to the current record level of drug overdose deaths in the United States. National Survey on Drug Use and Health estimates suggested that in 2016, 91.8 million, or 34.1% of U.S. citizens use prescription opioids, and 11.5 million misuse them. Every day, over 1,000 people are treated in emergency departments across the country for misusing prescription opioids. In 2016, 1,856 Marylanders died from an opioid overdose, including 418 of prescription opioid overdose. On March 1, 2017, Maryland Governor Larry Hogan declared a state of emergency related to the opioid addiction crisis.
This problem left us wondering what we, as student pharmacists, could do to impact our community on Maryland's Eastern Shore. Our plan is twofold.
Among U.S. adults with misuse, 40.6% obtained prescription opioids for free from friends or relatives for their most recent episode of misuse. In Somerset County, the home of the University of Maryland Eastern Shore, 23.7% of people live below the poverty line, ranking us second in the state of Maryland. With limited access to public transportation, commuting to a take-back site may not be an option for many. The first phase of our project is to help members of the community safely discard their prescription medication that would otherwise be left on a shelf in their home, leading for a potential for abuse. In order to achieve this, we will target local prescribers to pass out doTERRA bags. The doTERRA drug deactivation system is safe for the environment and can be used to deactivate nearly all pills, patches, or liquid drug dosage forms. It takes only 3 simple steps for patients to discard of their unused drugs. Step 1, place the unused medications in the pouch. Step 2, fill halfway with warm tap water and wait 30 seconds. Step 3, seal tightly and dispose of in normal trash.
In their recent release, the President's Commission on Combating Drug Addiction Crisis and the Opioid Crisis stated, drug deactivation bags would be particularly useful in rural areas where an authorized collector may not be nearby. Our goal is to reach as many patients as possible so that they will receive a bag and instructions for safe medication disposal with their opioid prescription.
Second, we will leave a lasting impact on the Eastern Shore by creating a series of educational posters to be hung in Walmart and Sam's Club pharmacies and public places. Topics will include locations of local DEA-authorized drug take-back boxes and instructions for safe medication disposal. We also plan to participate in the next National Prescription Drug Take-Back Day in our community.
The mission of our project is simple: to help patients make the educated decision to discard of unused prescription opioids in a safe and effective manner. Thank you for your consideration in helping us connect the pieces in our community.